Hello, today we will be conducting your heart, chest, and lungs exam. I will begin by inspecting and palpating your heart, looking at the precordium for any apical impulses, pulsations, heaves, lifts, and thrills. I will then percuss to estimate your heart size, which is actually better done via chest x-ray. And then I will auscultate your heart, listening for your rate, rhythm, and any splitting. I'll be noting your S1 and S2 and possible S3 and S4. Listening for any snaps, clicks, friction rubs, or murmurs. If my patient did have a murmur, I would document the characteristics of the murmur, looking for the pattern, quality, location, if it radiates or if it varies with her respiratory pattern. I will then be moving on to your chest and lung exam. I will be inspecting and palpating your chest. I'll start by looking at her anatomical landmarks, looking at her trachea for any deviation, noting her suprasternal notch, angle of Lewis, costal angle, and looking at her C7 and T1. While I'm inspecting, I will be looking at her size, shape, and symmetry of her chest, her AP diameter, color of the front and back, and noting if she has any superficial venous patterns that I should note. I will also then be looking at the prominence of her ribs, making sure that she doesn't have any protruding. So then for a minute, I will listen to her respiratory rate and rhythm. While I am listening, or while I am watching, I will be noting her chest movement for symmetry and if she's using any accessory muscles, or if she has any audible sounds such as stridor and wheezes. I will also be looking at her thoracic expansion, making sure that everything looks great. I will then percuss in the various parts of her chest, noting the intensity, pitch, duration, and quality of her percussion tones. And I will be also noting if she has any crepitus. And after that is completed, I will then auscultate her breath sounds. I will be looking to know if she has any crackles, rhonchi, wheezes, or friction rubs, and I will also have her state 99 to assess for tactile fremitus. And also, I am listening, I will be noting her vocal resonance. So after this is completed, her exam is done. I would then ask her if she has any further questions, and this concludes our exam.